episode of Let's Talk About Healthcare. I'm Marielle Summers, a part of the ACA Navigators team here at the Pinellas County Urban League, and today we're going to talk about Black history. So, let me introduce you to the rest of the team.
Hi, I'm Courtney Miller.
Hi, I'm Tony.
I'm Ivory Henley.
Hi, I'm Elise Martinez.
I'm Janelle.
And we are
ACA Navigators.
What are some of the basics that we should cover? Like, you know, Black History Month started off as Black History Week. Does everyone know that information back in? Yeah. What else? What else is
Is that
important?
where we're starting?
No, I'm just giving out the Black History must knows, you know.
Well, I'd say the Pinellas County Urban League fits directly into Black History Month and the work that we do as navigators in the actual community and bringing that lack of education sometimes that we know our community has directly to them.
Yeah. So it's a great month to kind of reflect on some of the accomplishments and some of the historical figures from Black history. So this month we've all taken some time to research our own Black history healthcare fun facts. So who wants to start? Let's dive right into it.
So I got some information on Henrietta Lacks, and that story is one that I've always heard growing up when I was younger. I've learned about it, I believe, first in school, actually overseas, and it was such a interesting story to me as a young black woman, realizing that there can be intrinsic value in just yourself, because in her story, I learned about the HeLa cell, which was a cell derived from her tissue, and it was used in thousands of research and studies, and actually used to help find a cure for polio and things of that nature. And she had cervical cancer when she was before she passed in 1951. And the fact that there was no consent system or that the doctors could use in order to formally get that information from her and know that her cells are going to be used in studies and that nature of things, since that wasn't there, the credit wasn't able to be attached to her.
Yeah.
And that's something that I think I've seen a lot of stories in the Black community of receiving credit for something you've participated in, work you've done way after the fact, because we had a lot of roadblocks years ago, you know, and some that we're still dealing with today.
But it's not even just the credit, it's how monumental to be a part of curing something like polio. Like, I feel like that's a recurring theme in our history as well, where you have Black people who have done extraordinarily marvelous feats in humanity, but not only can we not get the credit, we can't get paid, we don't get no recognition,
It's
we don't
so
build no
true.
monument,
Yes.
we barely making the history book.
And I mean, by the time, Henrietta Lacks was passed before the great discoveries of her cells were made, you know? So that kind of speaks to, like, she couldn't even be there to enjoy the value that she actually brought to the world, yeah.
That's really, really good. I like that. That's
I'd say that brings me to James Smith. So in 1837, he was the first African American to obtain his medical degree. However, he was unable to study in the U.S. So he went to Scotland to obtain his medical degree because none of the credible colleges and universities here in the U.S. would accept him.
That's good.
Wow.
That's
And
really
speaking of
interesting.
medical, something that I found out, I focus solely on Florida because we can speak on America and stuff, but it's really good to know a lot of the African American history in Florida. So I found out that Florida Agricultural and Medical Hospital was actually the first hospital in Florida to be built. Of course, it was underfunded because it was for African Americans, but they were the first institution to actually provide medical care for African Americans, especially during the segregation period. And it was officially a hospital in 1951. But information that I found was interesting was that the hospital actually closed as a result of the Civil Rights Act of 1964 and the federal government's threat to withhold Medicare.
Wow.
Withholding the first string.
Right. Funding from both the FAMU hospital, shout out to the Rattlers out there, and Tallahassee Memorial Hospital. It officially closed December 24th, 1971. So I found out that I find that was some great information.
Between
Yes.
what you just mentioned and what you just mentioned, we're talking about a span of 100 years.
Yes.
Pretty much. And like nothing's really changing in the favor for our people in this society. But we're still continuing to make great
Yes.
strides.
Right.
Like we're not being held back by the fact that society has segregated us and relegated us to second class citizens. I think that's just like an amazing commonality between those two stories that they're nearly 100 years apart. But here you are. But to your point about James, like I wanted to ask y'all what y'all thought about the fact that so many black people have had to go overseas
To obtain.
to find success. What do y'all think about that?
So, what was the gentleman's
James
James
Turner?
Smith.
James Smith. That what you were saying really reminded me of the story of W.B. Du Bois, because eventually he studied overseas abroad in Germany, but it took years. Like, and this is in all of his writings. The years that it took of him academically pressuring higher ups that he could, even the president, I believe it was Roosevelt at the time, to send a group of educated black folk, it was black men, overseas to study. And they were actually putting out information in the broader nation that they were able to find people up to the task.
Yeah.
But there were these men that had been studying, women that had been studying for years, that were proving themselves over and over again, wanting to go abroad to broaden their information, their intelligence. Yeah, and that was honestly withheld from them.
But see, that's the crazy part is like I'm thinking about entertainers, like people like Tina Turner and stuff, all the way up through, our parents' lifetimes and stuff like that, who had to find success overseas. Or think about during, what was that, y'all? World War II, where, the black soldiers were treated better overseas.
Then over here.
Then at home, yes.
So,
I think it's a pride thing, you know what I'm saying, or either an insecurity or being scared that the black culture was going to rise up and actually be the forefront of America. You know, and
But
Go ahead.
oh, well, I was just gonna say, it kind of gives me the feeling of a damned if you do, damned if you don't nature, because then we have black people in all these different types of spaces trying to be successful, whether that be education inside the country, learning outside the country. But either way, we still have these perceptions that we're dealing with internally or externally, driven of this means this if I do this, and that can actually hold us back from things.
So regardless of those disparities, we still rose to the occasion. Like
Yes.
we
We
still
sure
have
did.
a Henrietta. We still
Yeah.
have these people.
Yeah,
So
these hospitals.
Yeah, because we didn't let these things hold us back. There are disparities. It's been this way for 400 years. And, right.
Resilient.
But we are resilient and we are strong enough to overcome them, especially with the health disparities. I mean, those were huge. I mean, they treated us bodies like we were just something to maintain so that we were sound to work for other people. And even regardless of this, I mean, we brought herbs with us. We brought all these things from where our mother went. And even regardless of that, we still rose to these occasions. We still came out of that. So I feel like
And the
was
funny
a good
thing is, I was just thinking, I was like, why do we have to work so hard to
Oh.
get those things that we need? And I know, I get that all. Work hard, work this, and this always ponders through my mind. It's like we worked so hard. Like my great grandmother had to go through so much just for me to even stand the first in line, right? And it's just like, I just ponder and think on that. It's like I'm not asking for an answer. I'm just saying, like,
no, I
we
want
had
to. I want to
work
try and give you
so
some answers.
hard.
Yeah.
No,
You know what I'm saying?
because it's there. And to the fact that you brought to the discussion about the hospital, the Florida's first black primarily owned hospital. I think what's interesting about what you explained to us is that this didn't go out of business
Yep.
or, for malpractice reasons had to shut down. This was an undoing by the federal government.
Right.
And I think that is where a lot of the answers lie, where you're saying like, why is it that we have to work so hard and not get anywhere? It comes down a lot of times to our society and how it's organized and what's voted on. So I think back in with the Civil Rights Act, right, it made integration a way of life and segregation illegal. So they were pretty much trying to just go across the board and say, I don't care if you're all white or all black. If you don't accept all races, we're going to take Medicaid.
Right.
So I can see that, but in hindsight, we see how damaging it was to our own people for not having ownership, this, that, and the other. But in 2023, and Ivory, we were just talking about this, we still have the government working against our interests. Our own governor does not want to teach black history in the state of Florida at a high level
Yep.
in 2023.
It's
You
true.
know what I'm saying?
Yes.
So,
We gonna.
so, but here
Well-
we are continuing to work so hard, but we're met with our own, stop sign here in the modern era.
And I really want to piggyback on that point of work. We are doing the work, the hard work right now. Each one of us individually as a person of color, and even the person helping us to create this. So I see all the sides of the government in action in these actions, which is basically like, while we do have DeSantis doing what he's doing, and he is the governor of Florida with that power, we are still the Pinellas County Urban League, who is in contact with the direct community. The direct community that we're saying he neglects sometimes. So in all honesty, it's like we're funded by parts of the government, right? We're helping people get into the Affordable Care Act. And the thing that's made me be able to see that I want to be a part of this political nature of this country, this hardworking nature of this country, is the fact that I know that I'm with people that are like-minded, and we are a part of the bigger picture of everything. So while that's going on, like what gives me hope every day is coming to work with Black women like y'all that are great citizens, upstanding. We're doing great, amazing work in the community, like actually serving them hands-on. And that's where I get the motivation to do all the hard work.
We just
Something
had
I
to
want
pick
to
up the
add,
cross.
I'm just gonna edit this out.
Go
but
for it.
The work that you guys are doing is part of Black history. Like, if
Yeah.
you
It
look at-
certainly
I was
is.
about to
That's the point.
incorporate
That's
that. Yes. I said, because that work that
That's
we
why
are
I-
Yes.
doing is part of Black
Because,
history.
like, when you
I have some
look at
statistics to
10,
show you that.
15 years from now,
Yes.
part of Black history is going to be the Affordable Care.
Yeah,
Yes.
it is.
Yes, it is.
So should we? Okay, so
segue,
with that,
yeah.
segueing into that
Furthermore.
that means that we are part of Black history.
No,
Seriously. Seriously, that's what we're doing. The Affordable Care Act will be part of this history. With that in mind, I had some statistics on how so far we have helped in this community and across the nation with our disparities differences, right? So we had a lot of Black and Hispanic people that were not insured. I mean, before this act even dropped out. Thanks, Obama. So this is just a couple statistics that I just want to run out, that the Black and Hispanics had the highest uninsured rates prior to this passage of this ACA a law here, and had the largest gain since then. So the uninsured for Black adults dropped from 24.4%. Think about that number. 24.4% of the Black community across this nation did not have insurance.
That's a huge
And this dropped from
percentage,
there in 2013 to 14.4% in 2018. So that's a big percentage drop. 10 percentage
Yeah.
points from that. So I think that that's amazing.
That's huge.
And Hispanic adults, they decreased from 40%. 40%. That's more than the black race.
That's almost half.
That's half.
Almost.
Down to 24.9%. So they were where we started. So they've made a big stride as well. I think that this is part of the history. This is what we need to do to continue to keep this moving forward, making sure everyone is healthy. Again,
Right.
this is what creates our generations. This is what we're passing on to the next ones. So we're here for this time,
Yes.
and we're doing our part. And
It's our cross to carry right
Yeah.
now.
that's it.
Yeah.
We're carrying our part.
So that's one of my Black history facts here is, about 120 years ago, it was somebody else's cross to carry.
Yes.
The Afro-American Insurance Company was the fact that I looked up. turns out it was Florida's first African American insurance company, and it was founded in 1901 to provide affordable health insurance and death benefits to the state's African Americans.
Wow.
So the very work we are trying to bring to our community via the Urban League, the Afro American Insurance Company was there for Black people in the early 1900s. Mind you, we had only been emancipated for about 40 years at this point.
Yeah.
A lot of us were probably living in substandard living conditions. And most of the country was, white or black, just because technology hadn't advanced that much. So we were down in shacks and all of these down home stories you hear. But even then, there were those among us who were thinking about health
Yes.
and how to keep us healthy. I'd be interested though to know what holistic health practices they took on in the Afro.
Me too.
Did they have Vicks
honestly.
Vapor Rub?
No.
on the
Yeah.
side?
Herbal.
It's
Right. I was just thinking that ginger ale.
Ginger ale
It's
and
so
saltine
true.
crackers.
Right. That's it.
And the stories.
Yeah.
Go lay down and watch the stories, and you be
Yep.
alright.
Yeah.
What was their version of that?
Right.
1901?
Yeah.
Go pray about it.
Go
That was
pray
it.
about it.
Oh,
Yep.
That was in it. So,
That's cool.
Yeah.
That's good to know. I like that.
we've been around. We've been
Wow.
around. So.
So was it? It's not around still, right? It's
No, it
okay.
is since
Because like how
been
some
dissolved.
things can be changed into another name and stuff.
Yeah.
Okay.
That'd be interesting though. I do need to look that up to see what current black
Where they are,
owned,
yeah.
That would be
health
dope.
insurance
Right.
or because I see all kind of black entrepreneurs in the insurance game.
Right.
Whether it's life insurance, homeowners insurance,
Sure.
business insurance. So I'm sure there's an entity out there.
It has to be.
Yeah.
Nice.
Yeah, yeah.
Yeah.
Continue this stride and
Yeah.
pushing forward, making sure that we're continuing to move these numbers down and making sure we're touching our community. So if
And
y'all
stay black.
Stay
man.
black.
And stay black.
right,
Stay black.
Yeah.
share this with the rest of us.
I'm out here with y'all, man. Can we get this